Hey everybody, my name is Dr. Vince Gutierrez. I am a physical therapist. I practice out of Joliet, Illinois. You can find me at movementthinker.org. This is video a lot. I don't know if this is video 8, 9, what have you. But I'm going to recap what we've covered so far. Go back and watch the other videos so you can understand why this information was there. First is introduction. Second, what do you do for a living? Third, what do you do in your free time? 4, describe your symptoms. 5, how long have they been there? Are they getting better or are they getting worse? What do you think caused your symptoms? Are they constant or do they come and go? What makes your symptoms better? What makes them worse? Does time of day have any effect on your symptoms? Are you any better or worse when you're still or when you're moving? Are you waking up at night? Why are you waking up at night? How many times are you waking up at night? What positions do you sleep in? How firm is your mattress? How many previous episodes have you had? When was the first time that you had an episode of back issues? What's your previous history with... I didn't cover that. I'm going to cover that one today right now. Okay, I'll go back to that one. What previous treatments have you had? Coughing, sneezing, straining, bowel, bladder. How are you walking? Okay, previous history. I can't stop. I can't not cover that. Your therapist needs to know your medical history. Okay, so there are some things that... like for instance, if you have osteoporosis, there are some movements that we aren't supposed to be doing with you with osteoporosis because it increases your risk of fracturing parts of your spine, right? Not a good thing. We don't want to do that. All right. So we need to know your medical history. If you've had some surgeries, we need to know that. If you have some diseases, we need to know that. So again, this is just a very broad question. Tell me about your medical history. What do I need to know about your body that's going to help me figure out and just let me figure out if it's relevant or not, right? You just unload on me. And some patients unload on me, and it's like 20 minutes to take their history, which is fine. It is what it is. It needs to be done. Unload. Let us figure out whether or not it's relevant. Don't be ashamed. Don't think, that's so minute. It's not important. Tell me everything, right? I want to know it, and it may not have any bearing on what we do or what I say or how we treat, but we always need that in your chart so that we have a baseline from what to work with. Okay, next, what medications are you taking? And it may seem like a small detail, but we want to know your medications. And what does a physical therapist care about my medications? When we move you, right, we expect certain responses. Take a very basic example. Let's say that you're taking a beta blocker, and we start moving you, and your heart just never climbs up, right? You get this blunted heart rate response, and we just look at your heart rate to try to figure out, he's not working that hard, but really you're gasping for breath and you can barely control yourself. We need to know that you're taking a beta blocker, right? And so, if you're taking opioids and, Norco, Oxy, Tramadol, if you're taking an opioid, then we also need to know that because one of the side effects of opioids is this opioid-induced sensitivity. And if that's the case, it actually creates this like brain change, right? This change in your nervous system. And that could also be playing a role in your symptoms. And so we need to know that. At no point in time, I want to make sure that I cover this clearly because I get the questions from patients and they just don't know any better, right? At no point in time should your therapist ever tell you to change your medication. I'm straight in the camera. At no point in time should your therapist ever tell you to change your medication. That can only come from your physician, nurse practitioner, or somebody has the legal authority to change your medication. I can't tell you to take ibuprofen. I can't tell you to take Advil. Medication is not our domain. That needs to go back to your medical practitioner. So please, you want to ask me the question, that's fine, but I am going to push it off the same way I just did right there. That is not in my field of play. That is somebody else's playing field. We have to make sure that we're respecting our boundaries, and I don't want to come across as mean, angry, nothing like that. Don't think down on me. Don't think I don't know what I'm talking about because I'm pushing you off on somebody else. Legally, we have to respect our borders. And medicine, medication, those are the borders for the people that practice medicine. Again, moving on. How would you rate your health? Good, fair, poor. If you rate your health as poor and you look like you're really sick, well, then maybe you're a patient, that big red stop sign, right? I need to send you back to the doctor. And so if you rate your health as poor, I'm going to ask you, why do you say poor and not good? And some people, it's like, well, I only exercise 30 minutes a day. Oh, okay. That gives me an idea as to, like how hard you come down on yourself. You rate it as poor just because you don't exercise 30 minutes a day. But you really do need to understand why they're saying their health is poor. Have you had any imaging? Stop. You don't necessarily need imaging. Okay? I am not saying you need imaging. I'm not saying I want imaging. I'm just asking if you've had it, then what'd it say? It's just data, right? I'm not alarming you to say, well, how come they didn't do an x-ray? Why didn't you get an MRI yet? No, it's just data. So don't take it for anything more than data. The question comes back up again. Are you having night pain, right? Is your sleep disturbed? It's twice, right? You've seen that question twice now. That tells you it could play a big stop sign role and send you back out of the clinic. And so we need to know if your sleep is disturbed, why. You know, if it's that big of a problem, you need to go back and see your medical professional. Have you had any recent accidents or falls? This is one of those things where if you've had a motor vehicle accident, then maybe you do need an x-ray. If you come into the clinic and you're holding your head like this because you feel like if you let it go, it's going to fall off your body, okay, you should go see somebody else. You might need an x-ray. But for the most part, we just want to take that into account and understand whether or not there is some version of a trauma that we're going to need to refer out for. Have you had any unexplained weight loss? Again, if you're sick, you're having trouble sleeping, and you're losing weight that you didn't plan on losing, then you might have something going on, and you might need to be seen by a medical professional, right? But usually the response that I get for this is, have you had any unexplained weight loss recently? And I get, I wish, right? And I'm okay with that response too, because that's something that, tells me, all right, cool. You didn't lose any weight. There's no major red flag there. Finally, I'm going to ask, we've covered a lot. Is there anything that you would like to add that we haven't talked about yet? And some patients, they may talk about falling out of a tree 20 years ago, and they think it has an effect on their symptoms. And it might, right? And I'm not going to say it doesn't, but to the patient, that's relevant. That means something. So to me, it has to mean something. And it means it's data that I put down. And again, it's just everything on a board, right? And what does this stuff start telling me over the course of time? And what can I start, putting onto this side of the board is possibly relevant, putting onto this side of the board is possibly irrelevant, putting onto the middle of the board, not sure one way or another. So thanks for watching. You guys have a good night.